My name is Sarah Sawyer, and I'm a board-certified dermatologist. I started my career at the University of Alabama, Birmingham. I then decided that I wanted my own business. It's always been my dream. And in 2007, I started Dermatology and Laser of Alabama. When I started the practice, I wanted it to be a source of truth for patients. I felt like the media had a lot to say about dermatology. I wanted to represent a professional, ethical opinion, and that if the patients could come here, they could learn all about their skin problems. Most importantly, that they could trust what they were hearing and the solutions that were being offered to them. And when I look back over the last 12 years, I believe that our team has done that. We have become that safe place where people come to hear the truth, not be just sold a service. Every time we provide a successful treatment to these patients, it's giving them comfort and confidence. We love being on the journey to health and happiness for all of our patients, and that's why we're here. It's why we exist.
My name is Rita Kay, and I've been a patient of Dr. Sawyer's for 6 months, and oh my goodness, she opened up a world of products and ideas that just absolutely blew me away. But I didn't come into this office expecting my self-esteem to be turned around either. I think there was a low-grade depression that I didn't even realize until it was removed, and it was removed when I began to appreciate and love the person I saw in the mirror more. That's something that Dr. Sawyer and these wonderful girls have done for me. It's made a big difference in my self-esteem and I think life in general. And I love her very much for it.
Hey everybody!
Hey!
This is a little different this year, isn't it? Welcome to our DLA fall event. I'm Sarah Sawyer, and we are live streaming from our SkinCeuticals boutique right here in DLA in Birmingham, Alabama. Thanks for joining us. I am here with my crew, and this is a very spaced out event, including a visitor from outer space.
DLA Debbie.
DLA Debbie. Make sure you're keeping an eye on her for all the code words. Now, those code words are the way to win prizes this year. We are streaming today and tomorrow live events. Tomorrow's live event is going to be at 12:15, and it is a Zoom call. So make sure that you hop on that call as well. And we are having a live event Thursday from 12 to 7 by appointment only.
See you then.
See you then. Bye, ladies. So I just checked online, and we still have appointments available for the live event. At the live event Thursday, I will be injecting some Botox, and we will be doing some laser and other consultations that evening, but by appointment only. To make an appointment, you can go to our website, birminghamskin.com, and book an appointment. Now, our office has been optimally planned out for your care and this event so that you can take home the amazing results that you're used to without taking home anything that you don't want. To those of you affected by coronavirus, our heart goes out to you, and we would like to thank you all, our patients, for the support that you've shown our business during this time. Now for the details of the open house. Let's go to the presentation. Hey everybody! Thanks for attending today's virtual fall event. This week is our spaced out open house. So the goal of this event is to let you explore our practice and understand our philosophy, to take advantage of promotional pricing, and to enter the raffle so that you can win prizes. This year, our top priority is safety, so this event will occur while observing all recommended guidelines. Our promotions are great this year. Lasers, skin tightening, body shaping, and microneedling are 20% off. Skincare products are 15% off. You can pre-purchase filler at 2 or more syringes at 10% off. You can bank Botox at $11 per unit with a minimum of 50 units. These specials will be live in the office and online all week. In terms of live events, they will be by appointment only. You can make appointments on our website, birminghamskin.com. We will be having appointments for consultations if you have questions about any of our technology and what to purchase. And we will also have a live Botox injection clinic Thursday from 1 o'clock to 7. And again, you can make appointments on our website. Today's virtual event will include an overview of lots of information about our practice. I'll be going through a filler consult, an overview of lasers and lights, body shaping, and finally the VIP experience, where I'm going to explain some upgrades to our membership programs. Tomorrow we'll be doing our regular Treatment Tuesday webinar, 12:15 to 12:45, and I'll be talking about skincare and the best strategies. So the way to win prizes is different this year. We will be giving 5 code words out over the virtual events today and tomorrow. When you have collected all 5 code words, email them along with your contact information to DLA Fall Event by Friday, September 18th at 5 p.m. The winner will be drawn next week and announced at the September 22nd noon webinar. We will also notify patients if they have won. So the prizes are 4 $500 gift cards, some sets of skincare products, and the grand prize is a never-before offered day as a DLA VIP custom member, where you'll have concierge scheduling, you'll have 3 of my favorite anti-aging procedures, and you'll get a $250 skincare credit. If you have any questions, please let us know at dlafallevent2020@gmail.com. And again, for live Botox injections or consults, please schedule those at birminghamskin.com. Thank you.
We can do amazing things with injectables. We can lift the face, we can airbrush out tiny lines, we can define the jawline, we can do a non-invasive chin augmentation, treat under eye circles, and we can even relieve symptoms of TMJ disorder. But I believe people come here for the artistry. I also give advice about what I think is a natural look. A patient may come in and describe a certain complaint, and because of the artistry and the aesthetic eye that I've developed over the years, I can take that and translate it and use injectables to give the patient what they want. At the end of the day, I'm really a partner with them.
Now I'll be going through what goes through my brain as I analyze a patient's face. There are 2 ways to fill a face, in my opinion. You can line chase and spot treat, or you can treat the full face as a whole, with a mind for a 3-dimensional result. I have extensively studied and learned from some of the best filler injectors in the world, and part of studying is understanding what happens over the years to tissue, including bone, soft tissue, and ligaments. When I look at a face, I look at the periphery first, and then I divide the face into thirds: the upper face, the mid face, and the lower face. My best friend volunteered to be my patient for this project. I brightened up her picture on the right so that you can see the difference in light and shadows. And understanding lights and shadows is something that is very important when you inject fillers. You want the light to be reflecting off all the right places on the face. The first thing I do is I look at the outside rim of the face, or the periphery, and I draw a line around it in my head, but here I showed you how I mark it out. So you can see the ideal is an upside down egg, and Libby is 50 years old. Over time, her face has narrowed. So one of the biggest goals, the number one goal I want to do on her is to widen the upper face, which will make her jawline look narrower. Also, she has told me in the past that her right eye is smaller than her left and that people have noticed it and mentioned it before. So we're going to try to do everything we can to change that. Also, I feel like her right cheek is protruding off her face a little further than on the left. I want to see a smoother transition there. And then I also want to minimize the ligament show right through here. Fourth goal is to smooth out the cheek fold on the left. I also noticed that on the left, her lips are a little bit smaller and they don't evert as much. So I want to correct that. And then she conveyed to me that she wanted a little more eversion on both sides of her lips. Then I want to smooth out this marionette line. And then I want to fill these pre-jowl sulcuses that can give a pseudo jowl. The last thing is this masseter on this side. It's a little bulkier than the right. We treated her tear trough several months ago and it still looks great. So goals 1 and 2, I achieved with a little bit of Juvederm and some Botox. We put about half of a syringe of Juvederm in her temples and then did a little Botox for brow symmetry. One of the things I try to notice on the forehead, which is the trickiest place to put Botox, is any asymmetry. And I saw a small contraction. That means I need to be very wary of how much I put there. If my goal is to open her right eye, I don't want to put too much Botox there. I also took this picture of someone that came in with a Spock brow. This is from treating too heavily in the center of the brow and leaving the edges free to move. It creates this funny angle in the brows. It's good to lighten up the middle when you're doing that. So to smooth out the cheek, I wanted to use a little Restylane Lift and Sculptra. And then smooth out the cheek fold on the left. For that, I used about a half syringe of Juvederm Ultra Plus. Goal 5 is to evert the lips with a side goal of turning the corners of the mouth upward and giving her a little more border definition. Goal 6 and 7 to smooth the left marionette line and fill the pre-jowl sulcus. And I like velour for that because it doesn't add a lot of bulk. It's more of an airbrush. And then finally, Botox in the left masseter to narrow the lower face. I love to facial shape with Botox in the masseters, and I did that on this patient along with an Ulthera. So on the right is her picture after the injections. This is the evening after. You can see her lips are a little swollen and she has a small bruise, but otherwise you can really not tell that she had injections that day. But I want to thank her for being my volunteer for this, and thanks for joining me. We'll now show the live injections. So I'm starting out with goal number 1 on Libby's face, which is to put filler in her temples. This will do a couple of things. This will widen her upper face to help recreate that upside down egg appearance. Also, it will help lift the brow. When the temple loses volume, sometimes the eye can look smaller. So using filler to restore volume, it can help put her right brow a little higher and help make her right eye look open. You can see that I'm massaging with some pretty firm pressure. I do that for a couple of reasons. I want to mold the filler. It's very malleable when you first put it in. And then I also like to hold a little bit of pressure to minimize bruising. I'm looking back and forth to her other side to try to even it out and balance it out with her fuller left temple. Also, you can see that the yellow tool that we're using to minimize pain is called vibrata. My assistant will place that vibration down right before I inject so that it confuses the sensation and minimizes pain because you're actually feeling vibration instead.
This injection that I'm doing right now is my favorite. This adds a really pretty light reflectance to that top part of the cheek. That point can sink down as we age, and that little bit of filler right there can really make the eye look more perky, and it can lift the face. Now I'm injecting more of the central cheek where that malar ligament runs. That ligament runs from the inside corner of the eye down through the middle of the cheek, and it was more obvious on her right side than her left. So I'm putting a little bit of volume there. And with those two injections in the cheek, you can make it a little bit rounder. You can take out the distracting architecture, if there is any, and really give a youthful look back to the cheek. Here you can see I've moved on to goal number 4, which is smoothing out that cheek fold. I'm using a cannula in this area, which is a micro tube without a sharp tip. It's really useful when I need to fan product through the subcutaneous tissue, and it's very safe, causes less bruising and less pain. Moving to goal number 6, which is to put product in what we call the marionette line. I start up by the corner of the mouth and try to give support to the corner so as to help that downturned mouth corner that so many people complain about. Then I'm fanning product into the chin, which is going to really smooth that transition. A lot of times patients will say that they feel like that volume loss there makes them feel negative or sad. Another issue with that area is that when that area is hollow, it can create what we call a pseudogel, which means that the patient feels like their cheek is sagging down, when actually the only issue is that they have volume loss in this area. You can see that I'm entering at a little bit different angle on her right side because it's just a little bit different from her left, and I'm treating more of that pre-jowl sulcus area there. This doesn't take much product, and I really like velour in this area because it's more of an airbrush filler. I don't like using a bulky product down in the chin because there's a lot of movement and patients will describe it as feeling lumpy. This product is very light. It moves easily and is elastic with the movement of the face, and it's often my choice. Now, I'm really crushing on Restylane Kiss for the lips, and I really couldn't wait to do Libby's lips with this product. I'm using Vibrata as I inject from the head of the bed. These days, when I do lips, I always lay the patient flat and inject from the head. I'm putting these little picket fences, which is a technique used to evert the lip. Now, when I say evert, I am actually trying to flip the lip without making it protrude like a platypus. We've all seen those lips, and I feel like with this product, I'm a lot less likely to create that look. I'm putting a little bit less in her right side, but she wanted volume to be increased slightly all over. This is the area that I know will swell. Lips look a little bit bigger at first, And then over 2 to 4 days, the swelling decreases. Oftentimes when people first get lip injections, they feel like I put in too much. And then in a few days after the swelling goes down, they'll call and say that they want just a little bit more. We're getting very used to this, and we think that putting a little in and then a little later is always better than putting too much, even if it takes 2 trips. So I'm showing my work here, showing that I filled the temple, tried to smooth this cheek. It looks a lot smoother and more like the left cheek at this point. You can see that the cheek looks more lifted and youthful. And by smoothing that transition at the periphery, her right cheekbone doesn't appear to be sticking out anymore. I also smoothed out the nasolabial fold, smoothed out the marionette lines and the pre-jaw sulcus with velour, creating that smooth jawline. Now moving to Botox. I love to speak to a patient for a few minutes before I perform Botox. I like to see how they move their face. I'll always make people frown before I inject their glabella and lift their brow multiple times so that I can really see what they look like when they animate. The forehead can be a tricky place to put Botox, and I'm very, very conservative at first because too much Botox in the forehead can give the appearance that someone is mad or sad. It can also drop the brows. So we want to do that very carefully. You can see I'm pointing out the horizontal line that people complain about across their nose. This is created from frown and what I call squinching. Those muscle groups, when they contract together, will create that horizontal line. I'm having her smile now. She's not showing many crow's feet. I think she's been pretty loyal to Botox there over the years, so she doesn't need much. We will, however, try to lift her brow with Botox. These are tiny little injections, usually between 2 and 5 units each. A normal injection through this area is 15 to 20 units. I always try to hold pressure if I see a bruise trying to form. Now I'm injecting the bunny lines. These injections are usually smaller amounts, and sometimes I use between 10 and 12 units on the bunny lines. People always ask me if it's true that you should make your muscle movements after injection. I think that there's some pretty good evidence that Botox is taken up better and may last longer if you make expressions for the first few minutes after treatment. Now I'm moving into crow's feet and brow lift injections. So there's a circular muscle all the way around the eye. And I try to relax it on the entire lateral edge of it. When I'm looking at brow lift, the first thing I do is I make someone squeeze their eyes really tight like that and then lift their brow so that I can see the optimal place to put these brow lift injections. These are tiny units. And what that's going to do is it's going to take the lateral fibers of that muscle and keep from pulling the tail of the brow down and in. If this is started early, it can really help keep your brows in the right position as you age.
What a great friend. I mean, to let me fool around with her face that much, she's a great friend. So we will now open it up for questions. If you have any questions, please put your question in the comments section, whether you're watching Facebook or YouTube. So I have Kristen with me today. She's going to be reading me some of the questions.
All right, Dr. Sawyer, first question is, so we know all of the typical places that you can put filler, such as in the face, but where else can you use filler?
So I would say my two other favorite places to put filler are the hands. I've done some hands in the last couple of weeks, and they just look fantastic. A lot of times we ignore our hands, and we concentrate on only the face. And then the other place is the earlobe. So a lot of times our little earring hole gets droopy, and we lose volume in our earlobe, so our earrings point down. And just a little bit of product in the earlobe can really make the ears look a lot more youthful.
So when you're doing these filler injections, how do you decide which product to use when you're, saying you're filling the nasolabial folds?
We're blessed in the United States. We have a lot of products available to do a lot of different things. They're kind of like large and small paintbrushes. So when I'm doing lifting, so a lot of times when I'm injecting this lateral face and doing lifting, I'm using a higher or a thicker product. We call it a high G prime product. So that's going to be a product that goes more on bone and is more for actually lifting, not really plumping. And then there are other products that I use more as airbrush, so as an airbrush. So maybe for like a feathery line on the upper lip or a fine line, I would use a lower G prime product or a thinner product, so to speak.
And Dr. Sawyer, our next question is coming from Facebook regarding Botox. So where do you inject to help with TMJ pain?
So TMJ, that's one of my favorite places to use Botox. And years ago, I went to Los Angeles and I trained with an expert on this. So a lot of times I will start out just in the masseter, right along the jawline. And a lot of times when I palpate, it makes me hurt for the patient because their masseters are really firm. They're getting a lot of pain when they're grinding at night. The other places to inject are the pterygoids. So if the patient isn't relieved by the masseter injections, we can go further up. And then finally, the temporalis muscle can be injected as well for relief. And I've really been able to help a lot of patients who have bitten through their bite guards at night, or even patients who have had surgery before. But I think Botox is certainly something that you ought to try before going to a more extreme measure to treat TMJ.
And so speaking of Botox, this is a question that we get all the time in the clinic. How young is too young for Botox?
So how young is too young for Botox? I really don't base treatment recommendations on age, whether someone's too old or too young. If they have findings that I believe Botox will be therapeutic for, I think it's time. And when I say time, somebody who is already getting resting creases in the places where their expressions go. So for instance, the frown lines that don't flatten out when the expression is gone. This is a sign that with time, these are only going to get deeper, and there is no other method. Now I say trade name Botox. We also inject a good bit of Dysport, and there's a new neuromodulator on the market called Jeuveau. And so this also is decided with a consultation. If the patient has a preference, certainly we take that patient preference into account. But other than that, they do, in my mind, behave a little bit differently, and we explain that at the consultation.
Another question coming from Facebook, how often do you recommend filler for under the eyes?
So every under eye is different, and a lot of patients will come in and say, I want to get under eye filler. And sometimes that is an appropriate course of therapy, but dark circles can be there for a lot of different reasons. Sometimes there's a pigment change under the eye that we can treat with laser. Sometimes there's loose skin. Sometimes there's herniated fat that may make that patient a more appropriate candidate for surgery than non-invasive therapy. But we do a lot of, we call it tear trough filler, which is that infraorbital hollow. We do a lot of that. I probably do 4 or 5 cases a day, and it's a great therapy when it's the right patient.
Okay, and here's another really good question. So the patient asked, do you use filler or Botox when you're contouring the jawline?
So when I'm contouring the jawline, and that is one of my favorite things to do, I include that in the facial shaping that I love so much, we use Botox and filler. So if somebody has a wide jaw, you know, ideally we are an upside down egg. So we're fatter across here than here. But so if the jawline is wide, a lot of times I'll do some Botox just to narrow this bigonial angle. And then if the chin is retrognathic or if the jawline is not sharp, sometimes we'll use Ulthera. Kristen's a great Ultherapist.
Love Ultherapy.
And then a lot of times I'll do filler to enhance that jawline.
Okay, so now after you do filler, if a patient bruises, what kind of options can you offer them as far as treatment of the bruise?
The best way is to prevent it, obviously, but unfortunately bruises do sometimes happen. And when I see a bruise occurring, I use a lot of pressure immediately, and I'll just hold firm pressure there until that's stopped. Then we'll apply ice. And then a lot of times we will do topical arnica. You can also do oral arnica. And we do use our pulse dye laser almost every day for patients who have had a bruise, and they can be treated that day as well as several times that week to eliminate the bruise more quickly. It works very well.
It does work very well. Love pulse dye laser. Okay, so one last question. Do you inject men as well?
We do. We actually have lots of male injectable patients. A lot of men come in for Botox and the other neuromodulators. And then we also do filler. Now, aesthetics are different in men. They want different things. A lot of concerns that they have may be the frown lines. Men also like a strong jawline in general. So those are just some of the places, but we treat men, and no matter the gender, whatever the aesthetic desires of the patient are, we're here and we can customize the plan for them.
Dr. Sawyer, that was very informative. Always love talking about injectables. So that is all of the questions for this portion. We're ready to move on.
Okay, so next we're going to do a quick overview of all the lasers. You know, I've purchased over 30 lasers in my career, and we're just going to highlight some of those. So let's roll that presentation.
This practice has a very boutique feel, and even though we have that small practice feel, we offer the largest set of lasers in Alabama, and we are one of the largest laser centers in the entire southern United States. A lot of doctors will send patients here because they know that if something can be done with a laser, it can be done at Dermatology and Laser of Alabama. Even though you may have thought you had to live with this problem or that this problem is something that can't be helped, the answer is sitting right here. And nothing makes me prouder than to be able to say, you know, we can help you with that. So next, we'll do an overview of lasers and lights that we have in the office at Dermatology and Laser of Alabama. Expertise and technology are the two most important things when seeking cosmetic treatment. I'm a board-certified dermatologist. I did a cosmetic dermatology and laser fellowship. I led the department in cosmetic derm at University of Alabama. And then I opened my own practice in 2006. Since then, I've hired some really wonderful people to make up the team here. Margot Maples is our PA, and our fantastic laser techs are Kristen Wood, Michelle Alvis, and Sydney Ott.
So we'll start with skin rejuvenation and prejuvenation. The first laser and the busiest laser in our practice is BBL. It does a lot of things. It clarifies color in the skin, but more importantly, it stimulates collagen growth to keep the skin young and tight over time. It does a fantastic job with pigment, even in one treatment. And then this is another patient that had 2 treatments where I also added another laser called the Alexandrite. Within a couple of treatments, the skin starts to improve very quickly. When I want to wow a patient, I often employ BBL right off the bat. So this patient in one visit got BBL, some filler, and some Botox. And 2 weeks later, she came back, and this was her picture on the right. She looked great and was very excited. This is also a great treatment for rosacea and helps me manage rosacea patients better than just medicines alone. We treat off the face. We treat hands, arms, chest. This is a demonstration of how much sun damage is removed. So this is one of those ultraviolet light filters that takes out the sun damage. And you can see after 3 treatments, the patient looks much better. But the deep secret is really in the science of BBL. It changes over 1,000 genes in the skin and makes them more rejuvenated to be more like youthful skin, and it makes thicker collagen, which helps find wrinkles and pigment. So this gentleman had 12 years of routine BBL treatments. This is actually a dermatologist. On the left, he's 43, on the right, he's 55. Another patient after 7 years of routine BBL. So I recommend anywhere from 2 to 4 of these per year for every patient. Another one of my favorite maintenance devices is Exilis Ultra. This is radiofrequency energy, which delivers deep heat to collagen, allowing it to regenerate and thicken. RF energy can treat any skin type and even suntanned skin, so we often do these in the summer. This was one of our first patients that we treated with 4 treatments of Exilis Ultra. Another great neck picture. When I see the crepey skin starting on the jowls and on the neck, I'll often recommend this device in a series to treat. It's also wonderful. It has no downtime and it doesn't hurt. This is another patient who didn't want to start filler yet, but wanted to tighten her skin with Exilis Ultra. This is immediately after treatment. You can see the tissue contraction. So you get immediate contraction and you also get long-term contraction. We use Exilis Ultra off the face as well. Here's a great picture of the arms after 4 treatments. And on this patient, we combined Exilis Ultra with some Sculptra on the arms to tighten the skin. Moving on to Clear and Brilliant, another great maintenance laser. Clear and Brilliant is what I call a baby resurfacing laser. It's great for prevention. It's great for an event. It's wonderful to bridge the gap before you want an aggressive laser treatment, and it's wonderful for maintenance. It has minimal downtime, and it's a superstar for melasma. This is a patient after 6 treatments. Moving on to resurfacing with erbium and carbon dioxide. We have Fraxel Dual and we have AccuPulse CO2 laser. Resurfacing is much different than it used to be. Fractional laser can go deeper in the skin, down to where the collagen lives, where wrinkles and acne scars form. This is a patient after CO2 resurfacing. You can see the pigment is much brighter and her skin has a beautiful light reflectance. The Fraxel 1927 wavelength is great for stubborn pigmentation, and we use it off the face as well. We often employ Fraxel when we want to treat color and wrinkles. I combine Fraxel with Sculptra many times to get a quick result. You can see this is 4 months of having Fraxel and Sculptra, 3 treatments, and the patient looks great. This woman used Fraxel along with some Botox and filler over 3 years to maintain her appearance. This patient wanted to come in and have a lot of sun damage cleared off, and we were able to get her some great skin after 4 treatments. This is also a great device for Fraxel, or great device for acne scars and for surgical scars. This is a scar after a cyst removal that got better in 2 treatments. This is a patient who came to a board-certified dermatologist to have her laser treatment. The spot beneath her right eye was discovered to be a melanoma in situ. It had to be excised, and then we treated her scar with multiple different lasers. So this is why you want to see a board-certified derm. This is a result with Fraxel 1550 on the neck. I love Fraxel for stretch marks, especially on the abdomen. We're moving now into radiofrequency microneedling. These needles can go deeper than lasers and heat deep tissue. You can also use it on darker skin types. This is a great result after a series for acne scars. This is a patient we combined Infini, Sculptra, and Subcision for acne scars. This is another patient, Infini and Sculptra for acne scars. Another little niche for our Infini is to help these festoons under the eye. So people will describe them as bags, but it's actually part of a fat pad that starts to protrude with age. You can see in the bottom picture that it's much improved after Infini. Another patient where we tightened the skin there, we added a little bit of filler, the festoon's gone. Moving into Profound, this is our most recent purchase. This is deep microneedling. This is a patient 3 months after one treatment. This is the left side, there's her right. Here's another patient who underwent Profound 3 months after the treatment. Her skin is much tighter. It's also a great way to contour the jawline. Yours truly, 5 months after my Profound CO2 last year. This is what the downtime looks like. There is some bruising and swelling after Profound, but it shapes right up by a week. We are still rocking Ulthera 7 years later. This is ultrasound tightening. It basically goes to where the plastic surgeons go to cut and tack, but we instead are shrink wrapping it. It's great to reduce fullness around the jawline, and it's wonderful for facial shaping when we want to retrieve that upside down egg youthful facial shape. You can also treat the brow for upper lid lift. You can help the brows arch. Pulse dye laser is one of the first lasers I ever purchased. We treat rosacea with this. We treat scars from cosmetic procedures or otherwise. And we treat sun damage on the neck. This is that stubborn chronic sun damage that we combine radiofrequency and V-beam to treat. Also, I love my Q-switched alexandrite. That laser and picosecond laser can be used to remove stubborn pigmentation. E-matrix is a great laser when you have acne flared up and also some acne scars. This is a list of some other lasers that boost our results here at DLA. In my career, I've purchased over 30 lasers. Again, here are the specials. We hope you'll take part.
Okay, so we have Scott ready for his IPL today. We have his eyes triple protected. First, we have some IPL aid stickers, then a pair of gauze, and followed by a pair of metal eye shields. So his eyes are going to be protected. He'll still see a really bright flash of light, but what he's seeing is safe for the eyes. This clear gel that he has on his skin helps the laser to just glide across his face. So we reapply that after each pass. So Scott came in, he's a golfer. He really is more worried about his pigment. He's got some brown spots as well as some redness that we're going to be targeting. So the first pass that we do is our 560 nanometer. We're going to be targeting red and collagen. And then the second two passes are going to be more targeting pigment, and they're more superficial. So I'm going to do a couple pulses here on the left cheek. Okay, Scott, this is just me touching you right here on the left cheek. Here's the handpiece. Here we go. First pulse on 3. 1, 2, 3. Now I'm coming across towards your nose. 1, 2, 3. So as you can see, that bright flash of light each time the laser pulses. That's where the intense pulse light name comes from. And I'm right here on your jawline. 1, 2, 3. Only 2 more. Last pulse. Okay, so the first pass is done on the cheek. I'm just going to be reapplying the gel, and the next pass I will go down his cheek. So we do a basket weave type pattern just so that all of the skin is covered nice and evenly. All right, Scott, 1, 2, 3. So he's going to have a little bit of redness after this. 1, 2, 3. And his pigment will be much darker. That's exactly what we're looking for. 2 more. Last holds. So Scott, for his aftercare, is going to want to wear really good sunscreen. He will want to avoid any sun exposure for the next 2 weeks. So no golf for 2 weeks. And then we'll see him back in about 4 to 6 weeks for his next treatment. Okay, so we just got done with Scott's IPL. So what I really want you to notice is kind of an even redness all over the face. And then his brown spots have already turned darker since we've started treating. So what we're looking at is those brown spots have responded to the laser. And these are the ones that are going to turn peppery and then slough off in the next couple of days. So he's just going to do gentle skincare for the next few days, wait for these brown spots to slough off, and then we'll see him back in 6 weeks.
Welcome back, Kristen. What a great job
fun.
on that laser.
You know, it's nice when you have a patient that has a lot to work with.
He's a tough patient, that's for sure.
You know very well. So Dr. Sawyer, this first question comes in. They asked, if I'm 30, what laser should I start considering?
So I love it when a 30-year-old comes in because we get to really do all the preventive maintenance that we know for anti-aging. So we're going to start that patient on antioxidants, a good topical regimen with a great sunscreen. I'm also going to talk to that patient about probably starting either Clear and Brilliant or Intense Pulse Light. And they work a little bit differently, but regardless of the laser that we choose, we want our patients to start in their 30s getting heat into the skin about 4 times a year. So it almost doesn't even matter what the device is, but unless collagen is being heated, we're losing collagen. So the only way to build it back is with heat. And so that's why I love lasers. That's why I love maintenance lasers. And also at 30, we may talk about a little Botox for prevention and to keep the brows nice and high.
So speaking of the 4 times a year, tell everybody, Dr. Sawyer, about our package pricing and kind of how that works.
So a lot of our lasers, especially the Exilis Ultra, the Intense Pulse Light or BBL, and Clear and Brilliant, I recommend in a series. It's not a one and done thing. It's more like a workout regimen. So because of that, we offer package pricing. And you have a year to use those lasers in that package. And this event and all of our events are always a great time to pick up those packages because not only do you save on the package, it makes each individual laser treatment cost less, but you also get to double dip and get a discount on the package itself. So it's a great time to pick up those packages this week.
So here's a question from Facebook. What lasers would you recommend for over 60 plus?
So over 60, BBL comes in a lot. Now, at 60, we can have a discussion about resurfacing or certainly our deep microneedling procedure, which is profound, our non-invasive lifting procedure. But if the patient doesn't want downtime, we're still going to be talking about that BBL. I mean, I sound like a broken record. I keep going back to BBL. I've just had such a great experience with it personally and with my patients. And I really think it's the most powerful laser at any age, whether you're trying to treat or prevent aging. And there's really no downtime. So to me, it just makes sense for so many age groups.
I completely agree. In your consultation, when a patient comes into the office, what is your first thing that you want to address with someone?
Well, first I want to hear from them. I want to hear from that patient. A lot of patients will come in and say, what do you think? And I think that's a valid question, and I'm happy to give my thoughts. But a lot of times patients have some pretty good ideas about what they want treated. Today's patients are really educated. They're very savvy.
Social media has made
very
everybody
savvy.
Yeah.
And so a lot of times patients will say, I would like my jawline to look better. I don't like my profile view. Or I don't like how sad or unhappy I look. And a lot of times when patients talk about how they feel like they have that negative look, we're going to be talking about usually some Botox or neuromodulator, also maybe some filler, but sometimes the patient just needs a good skincare regimen, and we're happy to help with that too.
Okay, Dr. Sawyer, so that is all of the questions for our laser section, so let's move on.
Okay, those were great questions. We're moving now into the body shaping section of our presentation today, so let's roll that one. Thanks, Kristen.
Thank you.
We want our patients to feel confident in every area of their lives. That's why we've spent over a decade researching, testing, and curating the most effective body shaping and skin tightening solutions available. We offer cool sculpting and a comprehensive line of procedures that destroy unwanted fat, smooth cellulite, tone muscles, and tighten loose skin. We are body shaping experts. We invest in the latest technology and the most in-depth training. Each patient is unique, and our team is dedicated to developing individualized treatment plans that result in the beautiful outcomes our patients deserve.
Next, we'll be talking about our body shaping procedures. Experience and technology makes the difference. We have spent a decade in the body shaping business. We have more technology than any practice in Alabama, and we have done nearly 10,000 treatments. We have 2 sculpting devices, 2 Exilis Ultra devices, the Vanquish Me, Z-Wave, Cellutone, and Futura Fit. Our experience with body shaping has told us that results need to happen quickly to keep patients motivated. Fluid intake is key for all of our treatments. The extremes of heat and cold work best for fat loss. And the 2 most important things are that technique is everything, experience of the provider is the most important thing, and that combinations work best. Nobody comes to our office and gets one device. This is our body shaping and laser team, Michelle, Margot, Kristen, and Sydney. They are absolutely fantastic, and I'm so proud of them. A lot of different combinations work. These are just a few of the combinations we use to get the best outcome. Cool sculpting is the busiest device in our practice in terms of body shaping, and you can treat many, many different areas. You can treat that stubborn bra fat, abdomen flanks, legs, arms, and below the jawline. The way that it works is by creating a temperature gradient with the fat cells. So the fat cells are destroyed selectively, and then when the fragments are removed, the fat layer is smaller. Every treatment gets about 1/3 of the fat cells treated. The Vanquish Me does the same thing, but with heat instead of cold. We feel like radial shockwave therapy is absolutely necessary for best results, and we perform radial shockwave therapy after every fat loss treatment. You must mobilize the fat cells after they have been treated, and radial shockwave therapy gives better results faster. We have 2 of them, Z-Wave and Cellutone. Radial shockwave therapy works the same way that it treats cellulite. In cellulite, you have impaired blood flow, lymphatic drainage, fibrous banding, and rolling, rippling connective tissue. Radial shockwave therapy increases blood flow, increases lymphatic drainage, hauling away toxins and dead fat cell fragments. It relaxes and restructures the connective tissue so that it's smoother and more elastic. This is a graph of fat loss with and without Z-Wave. The top line is Z-Wave, and we have seen 10 to 40% better results over time. You can see the left side was Cool Sculpting alone, the right side Cool Sculpting plus Z-Wave. We also use Exilis Ultra on the body. We can control this machine to treat deep or shallow. So if we want to target fat, we move the heat deeper. If we want to treat the skin, we keep the heat on the surface. This is an Exilis Ultra and Sculptra treatment on the arm. Cool Sculpting and Z-Wave is the most common combo. This is a patient after 2 treatments. Another patient after 1 treatment. Arms do very well and the skin does tighten. Men do well in the abdomen and flank area. You can start to see the 6-pack on that abdomen now. Z-Wave by itself is also a great treatment for cellulite. 5 treatments once a week gave this patient legs that were ready for swimsuit season. This is a treatment with 1 Cool Sculpting cycle and 4 Exilis. This is another one of our favorite treatments to combine fat loss with Exilis as well as cellulite. This patient got these results in 6 weeks with this combination. This is another patient after only 2 treatments with Vanquish, Exilis, and cellulite. This patient wanted tighter skin on the legs and wanted the spots removed as well. So we did laser for the spots, Exilis Ultra, and Z-Wave on the legs. Same thing for this patient. This is a patient that also got Vanquish, Exilis, and Z-Wave all together in the same session. 4 treatments over 2 months. Another Vanquish and cellulite result. You can see this was over a period of 2 weeks that we delivered this result for this patient. 2 treatments. This was another patient getting ready to travel for spring break. And men do great with this treatment too. 4 treatments here and 4 treatments here. Again, these are our promotions. Thanks for watching. Now Michelle is performing an Exilis procedure. The Exilis is done on 2 different settings. One setting treats the fat and the other setting treats the skin. So we use the Vanquish to begin the heating process and then the Exilis to fine-tune and sculpt. Our first Exilis was purchased in 2010 and now we have 2 machines because we've seen such amazing success with it. This is the Z-Wave, which is ultrasound treatment of the treated fat. What this does is it mobilizes the dead fat cells into the lymphatic drainage to speed the result and enhance the result. One study showed that we can get 10 to 40% better results.
At Dermatology and Laser of Alabama, we're different. We have more technology, more knowledge, and more experience. We'd like to take what we have and combine it with your goals to deliver the best result possible. We hope to see you soon.
When trouble areas no longer respond to diet and exercise, we may recommend Cool Sculpting, the #1 FDA-approved non-surgical fat reduction treatment. We enhance our Cool Sculpting procedures by adding Z-Wave or cellulite to stimulate blood flow and lymphatic drainage for up to 40% better results in less time. And if needed, we can add skin tightening treatments in the same visit. We want our patients to look and feel their best. So if we can get to a better outcome in a shorter amount of time, we'll find a way.
Hi there. We are streaming live now from our Cool Sculpting Suite. I'm here with Master Cool Sculptor Michelle Alvis.
Hello.
She's been running our Cool Sculpting devices for 10 years. And our sweet patient Lisa, who agreed to come in and take some questions. Now, Lisa, the machine just turned off. She just finished this cycle. She is an ideal patient for this treatment because she's very healthy. She has a regular exercise plan. She does Pilates at Mountain Brook Pilates, right? And they're good friends of ours. And so she has a healthy lifestyle. So she just had some stubborn areas that she wanted treatment. So I believe we have some questions for the patient.
Yeah, Lisa, so this first question comes to you. Did the procedure hurt? And if you could explain a little bit about what it felt like.
There's no pain involved in the treatment. There's a mild tingling sensation as the skin is numbing, but there's no real discomfort. You would be able to bring your iPad or a book and comfortably read or catch up on your emails, but there's no pain involved.
Wonderful. And then I know that you've had Cool Sculpting before. What did you feel like your results were? I mean, as far as like, did your clothes fit better, or how were your results?
Previously, Michelle treated my lower abdominal area, and we had an excellent result. One of the things I was most excited about is how my jeans felt. So it was much easier, much more comfortable wearing your jeans, especially if you wanted to wear a blouse tucked in your belt. And it aided a lot in reducing that abdominal area.
Wonderful. So Michelle, this next question is for you. So A patient asked, how long does it take for one session of cool sculpting?
Typically, one session would take about 35 minutes. So we're treating Lisa's flanks. So we have 2 different cool sculpting machines. So we can hook them up at the same time and actually treat for 35 minutes.
Wonderful.
So it's anywhere 35 minutes to an hour and 15 minutes, depending on the area we're treating.
Okay, and then the next question is for Dr. Sawyer. If you could explain the device behind you.
Okay, so this is our difference maker. Several years after we purchased Cool Sculpting, I had heard something about radial shockwave therapy and how that it's a total game changer for Cool Sculpting. Well, once we tried it, we had treated one patient with one side with just Cool Sculpting and the other side with both, with Cool Sculpting and then the Zimmer Z-Wave. There was no comparison. The next day, the 2 sides looked completely different, and they never looked the same after that. So we decided that it was a must to have. We have this device. We also own the Cellulite, which is a different radial shockwave therapy device. And every time we treat fat in this office, we do this as well. And it's a value add. We do not charge extra because we feel like it's a necessary part of any treatment for fat.
So Dr. Sawyer, Michelle, and Lisa, thank y'all so much for being here with us.
Thank you.
And that is all of the questions for this body shaping portion.
Thank you.
When I first came to Dr. Sawyer, she looked at me and said, "You're an excellent candidate for a VIP program." She explained to me that it's a monthly fee that you pay and you get to come once a month, and there's multiple services that are offered. One of my favorites is the hydrofacial. It's so relaxing, my skin just glows. Also with the VIP program, you get a discount on all the products. With very minimal investment, the results have been outstanding. And people often ask me what I'm doing to my skin, and I'm always happy to tell them that it is all to do with the VIP program.
This is our last presentation and a very important one. Over the last 3 years, we have started 2 VIP membership programs. We started this because after sitting with patients over many years, I saw some real trends. First of all, they're overwhelmed with input from advertising, social media, friends, family, and the lady at the cosmetic counter. Even if you just take our practice alone, it can be overwhelming to filter out what treatments might be the best for you. We also saw consistent needs from thousands of patient consultations and discussions. They wanted a place they could trust, they wanted results, and they had a budget. We started these 2 programs. We have almost 300 members between the 2 programs. Our Glow program is $169 a month, and for that, you get a lot of different choices. The most popular are the Hydrofacial, the Diamond Glow Dermal Infusion, and Clear and Brilliant. You also get 10% off all skincare products, 20 units of complimentary Botox per year, and there are upgrades available so that you can get microneedling, advanced chemical peels, or a Luxe Hydrofacial for a small upgrade fee. The custom members are getting procedures that are a little bit higher price point. They can get 1 treatment per month, or we can combine up to 3 treatments on one day for our out-of-town or extra busy patients. For this, they're getting Botox Jeuveau or Dysport, IPL, pick 1 area, Exilis Ultra, pick 1 area, and this does include body areas, microneedling face and neck, brown spot treatment, V-beam for vessels, or a Clear and Brilliant plus a skincare product. We've also recently added, you can use 1 month for $500 off filler, resurfacing, profound, or Ulthera. These patients also get a year-long 15% off on all skincare products. So the most popular VIP Glow service is the Hydrofacial. This is a several-step luxurious process including cleansing and extracting, a light acid peel customized to your skin, extraction, and then we can customize with boosters, and there is a serum applied via vortex fusion. The whole thing takes about 30 minutes, and patients love these. The Diamond Glow Dermal Infusion is another very popular procedure. This is hydrodermabrasion, exfoliation with water and a diamond tip, while also infusing serums. The choices are skin brightening, vitamin C, pore clarifying, Ultra Hydrating, and the new TNS Advanced Pro. This allows for better absorption of products, and this is a fantastic in-office treatment for acne and melasma. Clear and Brilliant is another favorite maintenance device. It's available on Glow and on Custom. This is our baby resurfacing device that has no downtime. It polishes skin, and patients always remark on how great their pores look. This is our favorite treatment for an upcoming event. This is a patient after 6 months of the VIP Glow program. She arrived at our office asking for resurfacing, but I felt like this was a much better level of treatment for her. The Custom membership was started a year ago, and basically it's a personal fitness program with me as your trainer to get the best out of our practice for the best value. This has the highest grade anti-aging technology and techniques as choices. Multiple services can be performed on the same day, and it has the highest flexibility along with concierge service. So if you've had trouble staying on track with Botox, look no further. This program is wonderful. It's great value for Botox. It can keep those muscles relaxed over time, which is the way Botox should be used. Our concierge can make appointments for you. We also wanted to make sure that my favorite maintenance laser is a part of this membership. This is the most powerful anti-aging laser out there, and when done on a regular basis, can make remarkable changes in the skin over time. It helps us keep up with UV exposure and chronic problems, and ideally our patients are doing 2 to 4 of these per year. Also part of maintenance needs to be at the Exilis Ultra. This is our award-winning radio frequency treatment. You can treat upper face, lower face, body area, and there are great results with no downtime. You can also take, for a month, you can take $500 off a more invasive service like Ultherapy, Profound, or AcuPulse. Also recently, we've added filler. On any filler session, you can have $500 off if you use 1 month of membership for this. This was our VIP holiday party, December of 2019. It was lots of fun, and it was great to see our VIP members as well as their guests. I'll leave the chart up so that you can study this more, but the memberships have been a valuable asset for people who are really trying to get on track. It's easy to get a busy schedule and fall off course, only to arrive back a year later and say, where is the time gone? So we hope you'll take a look at these memberships and let us know if you have any questions. Thank you. So that's a wrap for us, and we want to thank you for watching, for supporting us through 2020 and every year before that. I want to thank Image Hive for helping us put together this production, and I want to thank my amazing staff that's helped me to create such a fantastic place to work, and thank our patients for coming, for enjoying the live event. Make sure you take advantage of the promotions. We do still have appointments, whether you're interested in a body shaping consult, a laser consult, or an injectable consult. We do have appointments available, so we hope to see you soon. Thank you. Bye-bye.